Hey folks, we're back. I'm your host, BKP. We're at Circuit World here in Blue Ridge, and it's time for Ask the Doc with Dr. William Whaley. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Now, Dr. Whaley, before we get started, I don't want you to lose your train of thought with that 70-inch sea turtle swimming over there on TV.
You know, I used to be a scuba diver.
That is not an aquarium here.
I've been diving that close to turtles before. Depth of to 90 or 100 feet. And I've been diving. I've been diving on the Great Barrier Reef in Australia, and been diving in the Sea of Cortez. It's a great sport for people who can do it.
Well, here at Circuit World, we've got about every TV and every size TV you can name, and in front of us, you can't see it, is this monster TV. Looks like an aquarium with a turtle swimming through it.
Yeah, it's got some 40, but say it's got some kind of pixels. You know,
it does
4010s or 1111s or something. It makes it really sharp.
Good to have it back this week. Now, we did tell our viewers last week that you were having a minor surgery. I'm going to call it that. Minor, major, I don't know. How are you feeling, sir?
Minor. I have my prop. You see, I'm holding this so everybody will see. I had to walk in here with a cane today. So
yeah, just don't grab it up like my grandpa used to.
No, I won't. But in about 10 minutes, 1 week ago, they were laying the knife on me for a total right hip replacement. And I've hobbled around on that a little bit, but I'm recovering pretty good. And my mama spent a week in the hospital when she had her hips done, and then a week in rehab. So they've got modern ways of doing it. And well, I repeatedly, in answering these questions, say we now can put a man on the moon, or we can make a telephone call by punching a button, when back in the past we had to jiggle the phone, because a lot of the questions are asked with historical bias way back. You know, I knew somebody who got radiation that burned them up, or, you know, those kind of questions. So this is just another example of the fact of the great progress being made in medicine, that I'm in here a week, less an hour from the time I got out of surgery with a blinking hip replacement. And I'm not taking anything except my baby aspirin as an anticoagulant.
Well, that was good. I'm glad you brought that up. No, we thank you very much, and I know the audience thanks you also for after surgery being in here with us to answer these questions. I do want to ask you this, and this is not one that we have this morning, and I want to start with it because millions of Americans take a low-dose aspirin in the morning. Millions of Americans have been prescribed that. Doctors say, hey, I want you to take a low-dose aspirin. Now, I always get concerned, and I know they do out here, when we're in our busy life and we get a 30-second clip on some CNN, NBC, or something like that that says a recent study. Right. And all of a sudden it comes out and it's something like take a bare aspirin in the morning, low dose, and it says it doesn't have the effects that was claimed or whatever. I don't want to step all over it, but you know where I'm going. Okay. So millions of Americans are wondering, hey, I take a low-dose aspirin. Should I continue?
That's a great question, because I am, first, a hematologist, second, an oncologist, and the first question I was asked in 1971 when I was taking my oral boards, the answer was an aspirin as an anticoagulant. So I would say I have as much history with this question as anybody in the world. Some sort of study, and the problem is studies are relatively complicated. They are measuring a certain population, and that population is the only population that the result applies to. The group that they applied it to were people who had no coronary risk factors. So they did not have demonstrated atherosclerosis of any artery, whether it's carotid, heart, or peripheral. They did not have high blood pressure, high cholesterol, or diabetes. So if you just take Leroy, and there aren't many Leroys that by the age of 40 or 50 do not have one of those things. I have been, we have people here in this room who have been demonstrated to have some degree of coronary atherosclerosis. We have some people in this room, I'll point over there, who have relatively high blood pressure that's difficult to control. We have some that aren't here yet that have diabetes and cholesterol and high blood pressure. Well, all of that group of people are benefited by the aspirin. The only group that wasn't was the people with no risk factors. And those people, it didn't harm them particularly, but it didn't benefit them. So at the end of the day, the 81 milligram aspirin, the hazard benefit ratio for the population as a whole remains on the benefit side. But if you're that small subgroup of people who are lean, fit, walk 20 miles a week, your blood pressure is normal, your blood sugar is normal, and your cholesterol is normal, it's not going to benefit you in terms of stroke or heart attack prevention, because it's unlikely you're going to have a stroke or heart attack anyway.
So, I buy low-dose coated Bayer aspirin.
You don't need to buy Bayer. Buy the cheapest one you can find.
Right.
I mean, I'm serious.
No, I'm not advocating for a brand. I hear you.
Understand,
okay.
but anyway, seriously, if you go to Costco, that big old bottle of 1,000 of those things is like $6. 30 of them at the pharmacy that say Bayer on them, or one of the other brands, but particularly Bayer, is the same price as 1,000 Costco. And the product's exactly the same.
Well, I agree with that. That's why. Well, actually, I buy 500, and I call anything a low dose Bayer aspirin. It doesn't matter what I buy. Sure, I'm just going to.
Okay,
it's like Kleenex.
It's like
okay,
Calvin
right.
Kleenex.
So, but I buy. So what you're saying is, if my doctor has told me, as part of my medication in the morning, take a low dose aspirin, I need to keep doing it.
That's correct.
All right. Sorry to get into that, folks, but yes, I think you out there also know that throughout the news this week they've been talking about your low dose aspirin, and we want to cover that with Dr. Whaley. Now we come to our first question, and let's see. Our first question: I was diagnosed with adrenal cancer. I am a female in my mid-40s. I read that the adrenal glands are on top of the kidneys. Would kidney transplant be an option for my treatment for this, or would it be risky compared to other cancer treatment options?
Well, first of all, it's in the same neighborhood as the kidney, so the kidney's got nothing to do with the adrenal, and transplanting the kidney would not do a thing for the adrenal gland. If you can show that first picture there, the one that's got the kind of blue background, being in the neighborhood has got nothing to do with being a kidney. And so if you look real carefully, it's sort of stuck to the top of the kidney.
Yes, I see that.
And it's got its total own separate blood supply. And adrenal cancer, I really think this patient probably does not have adrenal cancer. It's probably been told they have an adrenal tumor or an adrenal adenoma, both of which are not terribly uncommon. And we're going to spend the bulk of this discussion on the adrenal gland and the things that happen to it that aren't malignant. Because if it is a malignant adrenal tumor, there's one treatment for it only, and that's surgical removal. And if it really was an adrenal cancer, that kidney's going to come out. Everything around that kidney is going to come out, and if it's on this left side over here, that means the spleen tip, which lands on it, is going to come out. Probably the end of the pancreas gland, which lands under, is going to come out, and you're going to take out a hunk of meat that big around. It's going to be a 7 or 8 hour operation. So we're not going to talk too much about the adrenal malignancy, more the adrenal gland, because it's so important. And most of the time what happens is there is a condition, medical condition, that the family practitioner, gynecologist, frequently gynecologists, frequently dermatologists, diagnose that says you may have an adrenal tumor. And the word they always use is tumor. And that's where patients get the idea that it was probably malignant. So on the left-hand side of that thing there, you won't be able to read it too well, but it says function. Send fight or flight response to the brain. So as I had mentioned before, I did research in medical school on the adrenaline or epinephrine norepinephrine or noradrenaline, and that's what gets you like this. You remember the discussion? All right, so you're driving down the highway out here, your heart rate's 70, your blood pressure's normal, you're listening to Rush Limbaugh on the radio, you're calm as a cucumber, and a kid runs out in front of you and you slam on your brake. Within a tenth of a second, your heart rate's 160, your blood pressure's 160 over 110. That's the adrenal gland pouring out this fight or flight hormone, and that's there to protect you. The second thing that it says there contains a small amount of testosterone that may help with secondary male sex characteristics. Now, you'll remember that I said that a few weeks ago, female baldness, testosterone that is produced by the adrenal gland in male and females is the same. And as the hormone levels of estrogen begin to fall in women, the ratio of the estrogen to the testosterone changes and male pattern baldness begins. So again, that's wrapped up in the adrenal gland. And the last thing that it says is it also controls the body's water balance. Now go to that next one. Okay, the next one is, this is all about water balance. The adrenal gland puts out a hormone that in response to the sodium in the blood, which is a blood pressure related thing, in response to the blood pressure, which is adrenaline, norepinephrine, the fight or the flight, in response to your blood sugar, in response to what's going on in your liver, creates a series of hormones that regulate blood pressure, urine output, salt in the urine, how your liver takes the carbohydrate in food and converts it into glucose and stores it as fat. Every bit of that goes out of the tiny little adrenal gland. Now show that next picture there of the unfortunate woman. Here's why I say that the adrenal tumor quite often is diagnosed by the gynecologist, the family practitioner, or the dermatologist. This is a patient, and generally this is more common in females than males, where one adrenal hormone, which happens to have male secondary characteristics, is put out, and they become obese with the little skinny legs and the skinny arm in that pattern. This little hump on the back is called a buffalo hump. Their face gets red. Well, you'll notice the first thing that, other than looking at it, is high blood pressure. Right. So this is one of the causations of high blood pressure. And then this would be the bearded woman at the circus, because they get hair that can look just like a beard, or their hair on their abdomen has a male pattern rather than a female pattern. They get hair on their back like a male. They have irregular menstrual cycles. They may get bruising and so forth. They can become depressed, hostile, angry, or mean. They can become emotionally unstable. They can have sleep disturbances. So when a patient with this characteristic enters the office of the gynecologist because of the menstrual irregularities, or the dermatologist because of the acne, round face, or the hair, or enters the family practitioner's office because of the high blood pressure. In other words, some of these things may predominate over others, and he does an exam, he immediately says, you may have an adrenal tumor. Well, I think the person that asked this question is probably in that category, because most frequently the adrenal tumors are small, they are not malignant, but they are functional and they cause serious problems. And this is all the extra adrenal hormone causing these problems, the only treatments for which are medical blocking of them, that you don't surgically remove the adrenal, but there are complicated things we'll go to in a minute when we're looking at high blood pressure that your family practitioner, probably your cardiologist or endocrinologist, will end up treating this patient. She'll lose 75 pounds. Her hirsutism or hair distribution will go away, and the adrenal problem will be fixed. Let's go to the next one. Now, it doesn't look a whole lot like John F. Kennedy, but that's John F. Kennedy. He's the first person with high degree of public awareness who suffered from
Addison's disease.
Okay, Addison's disease is the opposite of this disease. Addison's disease is where the adrenal gland does not produce all of those hormones before that I said keep your body salt regulated, help with your liver doing things. So the very first thing that a low adrenal function patient will complain of will be fatigue, weight loss, gastrointestinal disturbances. Their blood sugar will be messed up and they'll have low blood sugar. When they stand up, their blood pressure will fall because their salt balance isn't good. They will begin to get changes in their hair distribution. Instead of having hairy like that, they'll get losing hair. And then the same set of doctors, the dermatologist who sees them because they're complaining of low hair, the cardiologist who sees them because every time they stand up they faint and their blood pressure falls, again will diagnose low adrenal function. Well, that low adrenal function might be due to an adrenal tumor that's non-functional but replaces the functional tissue that is normally present. So here you have, first you put them all off there for a minute. So here you have that adrenal gland sitting there. And if it's a cancer, it's a big deal, and we've thrown that out already because it's so rare. But there's relatively frequent, because I see these multiple times a year, functional adrenal tumors, and you get either the male or the female with a high blood pressure and the funny distribution of hair and the blood sugar that's elevated and so forth, or a non-functional adrenal tumor that replaces the normal tissue, and you get the Addison's disease thing. Now, since blood pressure came up, and we've been talking about blood pressure here every week, you're going to take this home.
Okay.
And you're going to study it because this is complicated. That's regulation of blood pressure. When you got that one up, this is really complicated. Down here at the bottom, you got the adrenal. Up here, you got the heart. So the heart, in the atrium of the heart, I've got atrial fib, remember, it secretes a hormone called the natriuretic hormone that goes over to the kidney and makes the kidney excrete sodium and water. Now, you'll remember that the kidney filters 160 liters of blood a day. We're only taking in, let's say, let's use about the quart. That'd be 180, say, quarts a day that the kidney filters when you actually put out a quart or less. So it takes 180 quarts of plasma a day and lets a quart of it come out. And so all the salt that's in that 180 liters of plasma has to be reabsorbed. And that reabsorption is under the relationship of this hormone to try and keep your blood volume normal. Now, if your sodium falls, if you look at this side, the kidney starts to secrete a hormone called renin, which becomes angiotensin 1 and 2. That then makes the adrenal gland make another hormone, and that goes up to the kidney, where the kidney again will reabsorb the sodium and the water, and then get the right amount of water. Your blood pressure will be controlled. Well, that's why when you have multiple blood pressure medications and you change the blood pressure medications, they are operating all in a different part of that system. So the common early blood pressure medicine, just the diuretic, just makes you excrete more water, which decreases the blood volume, and then all the rest of these things here are there to try and keep the blood volume normal. You got it?
Got it.
But key component there is the adrenal. So that's why we went back to blood pressure today. The adrenal gland, if it's working right, it helps. It does everything to help you keep your blood pressure normal. And if it's working wrong, it can make it lower, it can make it high. There we go.
I'm still looking.
You got to take it home and study. I'm going to give you a quiz.
I know. You told me already So I was just taking a brief look at what I have to go study for the test.
Next week, all right.
Again, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital. We appreciate them for this segment. And they bring our next question. I'm a 56-year-old. Let me start again. I am a 56-year-old man, and I have started experiencing numbness in my toes and fingers. It happens when I'm walking or sitting at different times of the day. The only thing I noticed is I have been getting really thirsty, more so than usual. I wondered what could cause this, and should I wait and see if it passes?
Okay. Number one, I don't know how bad it is. All right? Can't tell how bad it is. Does it interfere with your walking? Does it interfere when it happens in your fingers with you drinking a cup of coffee or writing a check? Number two, by listening to that, carefully reading it, it is not omnipresent, is it?
No.
It occurs intermittently. So if you go to the first picture there, that beautiful orange picture, you're going to love this one. This looks like that ad on television. Typical peripheral neuropathic symptoms. The symptoms that they're talking about, since they're in fingers and toes, are clearly neuropathy, because it is numbness. It's not hot, it's not red, it's numbness. And the typical, you'll know this typical numbness is the bottom right-hand corner there, but people lots of times can say that they can call it loss of feeling, and if there's a pain characteristic to it, as there sometimes is, but generally what they're talking about is a temporary peripheral neuropathy. You remember a few weeks ago we were talking about park bench paralysis, when you have your arm up over the park bench, or you've crossed your legs long enough to where you're sleeping, you wake up and your hand won't move, you take it off there and you shake it and it comes back. So if this is the kind of thing that shaking your hand makes go away, it's a temporary low vascular supply to the ends of the fingers and toes because they're long downstream. But if it is moving it doesn't make it go away, and moving your feet doesn't make it go away, then you are in the peripheral neuropathy system. And if it is persistent more than a couple of weeks, then you got to go see your family doc. The second part of it was, I am thirsty. So if you look at the causes of peripheral neuropathy, Josh, put that up there so that people can read it. What's the number one cause of peripheral neuropathy?
Diabetes. What is that?
Diabetes mellitus.
Diabetes mellitus.
Okay. Now, Josh, what's the first symptom people complain of if they are diabetic and not diagnosed? It is, I wake up at night and have a lot of urine, and I'm having a lot more urine than normal, and I'm thirsty all the time. So the thirsty all the time, if it's not hot and you're not out in the sun, is because the sugar in your blood, when it gets down to the kidney cannot absorb the water with it, and you're putting out quarts of urine a day instead of 1 quart of urine a day. So the secret here to this question is, I'm thirsty. So if this has not gone away in 10 days or 2 weeks, you got to go to the doctor and find out if you are diabetic. I've seen this twice in my career by people who were being poisoned by arsenic. One of them was being poisoned by arsenic by a human being, and the second was being poisoned by arsenic by mistake. So if you go through this whole list of things, they get down here to where there are various toxins, lead, and some chemotherapies. But the second cause of peripheral neuropathy on here is B12 deficiency, and the third is alcoholism. All right.
Yes.
So we don't really know whether this patient is, but if it's an alcoholic, it wouldn't be complaining of thirsty all the time. If it was a B12 deficiency, they wouldn't be complaining of thirsty all the time. And being a and using thirst as a major part of the question, I would say if it's any kind of thing at all that's real, it's diabetic neuropathy.
What about if you're sitting there watching college basketball, which we're all watching right now? What if you're sitting there watching college basketball and you get up and when your feet hit the ground, it's like 100 little needles just shot your foot? What is, because I didn't see that particularly. Is it, I mean, I saw the.
If you go back on this one, there is sharp jabbing
pain. There it is. Okay.
Okay.
I didn't know. All right.
Okay. Well, the sharp jabbing pain of diabetic peripheral neuropathy is what you see in the TV ads every day when that guy's walking on glass, and so that if it's a little bit numb, people don't complain of it enough to go do anything about it.
Right.
But if they're standing on glass, they want to know about it in a heartbeat. And since there's an expensive drug that helps it, that people are going to tell you about it on television about 100 times every day if you watch cable TV. So that is a peripheral neuropathic symptom, to feel like you're walking on glass. Now, if you're like me and you're watching this game and you're lying down and your feet are up and you got a box of popcorn on your chest or on the ground right here, and the only time you get up is when they have in the long commercial breaks at 13 minutes or at the halftime, and you've got to go to the facility when you wake up. My feet are numb because I've been lying there so long, a puppy on both legs, then I don't think there's anything wrong with that except you've been sitting in one position too long.
All right, I don't want to gloss over now. I know we got to get moving along here. We have the All-Star Political Panel. We've got a really great special. You're going to really like this next segment. I don't want to gloss over the arsenic poisoning. You said one time by mistake and one time by a human. Did you have to testify in that case? Should I bring it? I didn't want to gloss over that arsenic poisoning.
Interestingly enough, I did have to do a deposition.
All right, I was just okay. All right, I didn't want to gloss over.
And that's been about 40 years ago.
Really?
Yes.
Okay, because
and the diagnosis was made by Dr. Bernstein, the neurologist that we have always talked about, who quit because he got tired of Obamacare and the medical record. But Dr. Bernstein, when he saw this patient with peripheral neuropathy, noticed something else. I mean, dry skin or flaking of the hair or something, and he immediately said, you have to do a screen for heavy metals and toxins and stuff, and that's lead and mercury and a bunch of stuff, and it was arsenic. And the arsenic was being administered slowly by a wife. I've never heard of an arsenic poisoning, even in history or in literature when you watch it on TV and it's from hundreds of years ago. Men don't poison people by arsenic. It's basically women.
Okay, I should have never touched that.
Is that sexist?
Oh, I didn't hear what you said.
No. Well, just
like
pretend you weren't.
Mushrooms. Remember
I should have never started that. Okay.
Women are the only ones that
anyhow,
poison somebody by arsenic.
Moving right along. Anyhow, well, first of all, thank you very much. I know you're recovering from your hip surgery, and I know it was a lot for you to come out and do this morning, so we want to say thank you very much.
It got me out of bed. I thought it was wonderful.
Okay, now, but I never like to leave without giving you an opportunity to discuss anything that's new and out there in the medical world. And if you don't have something this morning, don't worry about it. I know you.
Well, we scooped Tucker Carlson.
Okay, we'll take that.
We scooped Tucker Carlson here 2 weeks ago. And Tucker Carlson picked up, whether he was watching my segment or not, or whether he got to the final being published Lancet article last night. He gave about a minute to the adverse effects of marijuana and the fact that daily marijuana use increases by 50% the incidence of psychosis and schizophrenia. Now, you remember, did I do that 2 weeks ago? When I got the Lancet online before it was published. This is a huge study done in Europe. So it's not colored by any of our liberal institutions or our tree huggers that think that marijuana cures the national debt and hemorrhoids and everything else. And it was done in people who have free access to marijuana. And the deal is that the more legal it becomes, the more powerful it becomes. And the more legal it becomes, the more likely it is that people will smoke it multiple times per week. Not multiple times per day, but just multiple times per week. And if they smoke it multiple times per week, and I think the definition was 3 to 5 or more, and I really believe in marijuana smoking states, people smoke it maybe 3 to 10 times a day, I don't know. But psychosis is going up like crazy. Psychotic behaviors of those people that go nuts in the supermarket and grab a thing and throw it around, or schizophrenia, where you hear voices that aren't there, you know, and the green man in the suit's telling you to go out and do something. So this is not a benign drug. The medical uses of it are real, but as soon as it's legalized, people with a tendency to want to sit underneath a tree and smoke instead of getting up and hammering nails to build a house all day, I think you're going to see a lot more mental illness than we scooped Tucker Carlson.
Dr. Whaley, we wish you well in your recovery, and we thank you for bringing yourself out this morning and doing the show and answering these questions. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. And don't forget, if you have a question for Dr. Whaley, you send it to info, I-N-F-O, at fetchyournews.com. Put in the subject line there, ask the doc. We'll get it to Dr. Whaley. And if you want to watch several segments or send these segments to your friends, go to our YouTube channel, FYN TV, Fetch Your News, and go to the YouTube and hit playlist, and you'll find Ask the Doc, and they're all loaded there, and you'll be able to send those to your friends or watch again. We're going to take a brief break. We have a special all-star political panel. Now, I don't know if you said something a minute ago. You said, is this sexist? All right, you looked at it. So I'm about to say something the same way. Now, we're going to have an all-star political panel. It's going to be one of those, I wonder if I'll get a word in edgewise. We're going to take a brief break, and we'll be right back.
Ace is your healthful place for paint and home goods, tools, outdoor living, and lawn equipment. But did you know Ace Hardware of Blue Ridge is a little bit more? We have hunting rifles and accessories for your next hunting trip. We have Amish furniture imported directly from Ohio. And we have Ace Custom Woodworks for all your custom wood project needs, from cabinets to artwork. Ace Hardware of Blue Ridge. We have your new house in stock.
Hi, I'm Rhonda the Mattress Lady, and this is my husband Gary, owners of Mattress Overstocked in LJ next to Walmart. And we want to earn your business. From the time you walk in our door to the time we deliver your new mattress to your door, you will see the difference. Our selection and prices are the best in North Georgia, and customer service is our top priority. So y'all come on in and let us help you find the right mattress at the right price. That's Mattress Overstocked in LJ next to Walmart.
North Georgia Diamond is your source for diamonds. Come on in to view the area's largest selection of fine jewelry at North Georgia Diamond. All repairs and designs are done on site by our jewelers. And North Georgia Diamond has the lowest prices on loose diamonds. You can also sell your gold, silver, and coins at North Georgia Diamond between Walmart and Lowe's in East LJ. Locally owned by Bill and Allison Craig, North Georgia Diamond is your source for diamonds in North Georgia.
In 1981, Reed Nicholson began selling tires out of an old barn in Mineral Bluff. Little did he know that he had just laid the groundwork for the most trusted names in automotive services in the Blue Ridge area. In 1997, Nicholson Tire Center became what it is today, holding the same values of faith, family, and great customer service. 2 locations to serve you, and the Blue Ridge location is currently expanding to offer fast service and the largest U-Haul provider in Georgia. Nicholson Tire Center, Blue Ridge, and Mineral Bluff. Circuit World, with multiple locations to serve you in Murphy and Franklin, North Carolina, Blairsville, Blue Ridge, and Ellijay, Georgia. Locally owned and operated since 1985. Appliances, electronics, and furniture. Name brand products like LG, Samsung, Dell, Whirlpool, Ashley, Catnapper, and more. No credit check, only 10% down on furniture, and only $10 down on any new lease purchase. Mention FYN10 for your special deal today at Circuit World.
Hello, my name is Chad Watkins. I'm the manager at Larry's Body Shop. We are a family-owned and operated business and have been serving the North Georgia area since 1978. We are located at 1216 Progress Road in Ellijay, Georgia. Our shop specializes in collision repair and we work with all major insurance companies. Larry's Body Shop is ICAR Gold, the highest role of training recognized by the collision repair industry. It is estimated that only 10% of collision shops meet these standards. Our shop consists of state-of-the-art equipment such as laser measurement system, down-drive spray booth, spot and MIG welding equipment. All of our paints are mixed on site so that we can guarantee your paint to match every time. I know that having an accident can be a stressful event. We take pride in making sure our customers are satisfied with the repair of their vehicles. Our waiting area is clean and comfortable with free Wi-Fi and refreshing beverages. So if you're in an accident, stop by and see us at Larry's Body Shop.
It's truck season at Days Chevrolet in Jasper, and that means it's time to haul home a payload of savings. Now save up to $6,700 off new Chevy Colorados at Days, or save up to $10,000 off new Chevy Silverado 1500 crew cabs. If Chevy makes the truck, we've got it, and you're going to save big during truck season. Going on right now at Days Chevrolet in Jasper, where new Chevy trucks cost less.
Better days ahead, Days Chevrolet.
Find new roads.
Do you feel like healthcare has become too impersonal?
3 times an hour, I'll get you in, I'll get you out.
At Lifetime Medical Center, you're more than a number. We get to know you, not just your medical issues. Dr. Alana Kent is board certified in family practice and offers same-day appointments. She and her staff treat conditions from minor to chronic issues. Lifetime Medical Center, convenient to Jasper and Blue Ridge.
This may sting a little,